So as promised, we have our second follow-up video about ruling out some wrist pain, some forearm pain, and the difference between the top and bottom, golfers, tennis elbow, so forth.
So there's two main components of the elbow we talked about. There's the medial part, which usually gets classified in the golfer's elbow kind of problem, and then the lateral part called the tennis elbow problem. Those diagnoses in themselves just aren't good diagnoses anyway. Just lets you know that something's going on in there. So we're going to go over both regions and what's typically who has it and what presents with it. So you got the medial part here. This is the golfer elbow crowd, but it's actually funny because people that get it aren't actually golfers. They're like people that do a lot of grip work, a lot of powerlifting, stuff like that, catching things in the clean, things like that. So what happens is these muscles are really involved in gripping and providing stability to the wrist. They get overworked really easy and they develop a lot of scar tissue, which limits the range of motion, mobility, flexibility, all that stuff. So these are people, like I said, that are doing a lot of cleans and catches, but
a lot of pulling. They'll
come in a lot of times with pain in the wrist when they get it. And what they do is they feel a lot more pain actually when they release stuff. We talked about when you release the muscle, it kind of allows it to relax a bit. So if there is pain, you're going to get more pain when you release stuff. The other area out here is your lateral elbow. This is your tennis elbow kind of area. This is people that, you know, just do a lot of office work or typing, doing a lot of stuff, repetitive kind of things. Well, we talked about that first video. It's all tied into the
fingers, right?
Yep, those muscles never really get a break. And these are the people that really don't notice it during work hours and stuff like that, but then they go and do some recreational stuff, like trying some CrossFit or doing, you know, yoga or something. They'll feel it in there, and it gets really beat up. So it always gets junk box diagnosed with like some type of tendinitis, which is complete bullshit when they talk about tendinitis. It's not even a good diagnosis. So what it actually ends up being is that this area is really more likely to get a degeneration in there. So the tendon itself degenerates. And what that's called is actually a tendinosis. So you have a bone, and then it has a tendon in there. And the tendon kind of looks like this. A healthy tendon looks like pre-cooked spaghetti before it comes out of the box. It's really strong. It's hard to break.
Nice and straight.
Yeah, nice and straight. Gets a good blood flow. But over time, when you overwork those muscles around there, it causes the tendon to get overworked too. So what the body does is it actually lays down inferior tissue, which is actually called the tendinosis. So this looks like cooked spaghetti. It doesn't get a good blood flow, it doesn't get good oxygen, it's weak, it causes all sorts of problems. So way to know if you have tendinosis is a couple things. Feels worse in the morning when you first get up. Feels a little better with warming up, which is actually dangerous because it's okay when you're doing exercise, but then it's really banged up afterwards. You get a lot of swelling, a lot of pain. The really scary part about this is 97% of tears were a tendinosis before they started. So healthy tissue doesn't tear unless you got in like a car accident or something. But these are people where they're like blow out their Achilles or blow out their elbow, and then you go in here and that just tears and that causes a problem. So if you're having lateral elbow pain, you work at an office all day and you have all those other things where it hurts worse in the morning, better with warm up and pain after, chances are you do have a tendinosis in there, and they're big, bad, scary shit. And they can cause a lot of problems. So what we're going to do for a follow-up video is we're going to go through some screening stuff actually for the actual medial elbow there to test some length of some muscles and some stability and see if you do have a problem. And then Nicole's going to show us some basic, you know, maintenance stuff to kind of keep things clean. And then we're going to go a little more in depth about actually getting it treated if you have a problem or an injury, and how to recognize the difference between something being sore and if it actually has some pain or an actual injury itself.
All right, so let us know if you have any more questions regarding this video. Again, we're filming a follow-up about how to treat it if there is an injury necessary for someone to kind of intervene, a practitioner to help you out, versus maintaining your tissues, you know, so you don't get to this point. And that's what I'm going to be focusing on.
And the other thing too is we like doing this, and it's a good idea. So if you guys have any injuries you want us to talk about, please feel free to comment or message us, and we'll be more than happy to address your comments directly.
Awesome.
Thanks.
See you guys later.